So why should I get the vaccine if I've had COVID and recovered and developed natural antibodies, especially if you're saying that I have antibodies that will last about a year, and the CDC is suggesting that a booster might be needed in less than a year? Why does this make the vaccine more superior?
Actually, it is hard and it's a very individual issue in terms of how you respond and react to the disease. So some people will have an antibody for a longer period of time than others, and as Dr. Bassi said, immunocompromised, they're needing a third shot of booster and that's increased their antibody levels. So when you get the real disease and you do develop antibody, you have antibodies that can be tested, but the correlation between your antibody levels and true immunity, I'm not aware of full good study yet that's to show that if you're at certain level, you're immune from the virus. Definitely you have protection, you have different mechanisms, including T cells and others that protect, but there's no way that we can so far use that at this point.
So there's a study published by the CDC in the MMWR, the monthly morbidity and mortality report, where they looked at Kentucky. They did a case control study in Kentucky, and they looked at patients that had COVID versus patients that had COVID plus the vaccine. And they looked at reinfection rates in these patients. And they could clearly show a difference. The people that had the COVID plus the COVID vaccines were much less likely to become reinfected than people that had COVID alone. So the point is, you might have COVID, you might have natural immunity. We don't know how long it lasts, and the variants can overcome the previous immune response you might have had. So reinfections occur.